Um, so what we're going to do is we're going to talk about the regenerative medicine that we offer, and we always start these talks with this 1-minute video, and what it shows is a man living the last 10 years of his life. One side he's living in health span, the other side he's living in disease span. Our goal is to get people to live their entire lives in health span, to really reintroduce the quality of life, so it makes people's lives much better, as opposed to being in a situation where you can't move and you're in a hospital medicated and going to doctor's appointments every other day. So we're going to just start with this video here.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
Okay, so this is what we offer at my office, regenerative cellular therapy. Now, there's two types. Basically, we have platelet-rich plasma and the stem cells, and this is why we age and we don't heal as well when we get older. You're probably noticing some of the videos in the beginning. When we're born, we are given this huge donation of stem cells. The ratio is like 1 to 10,000 when we're babies. We use up most of them by the time we're skeletally mature, at the age of around 20. We use up 90% of them. So we're stuck with only 10% for the rest of our lives. So as we advance in years, we go into degeneration as opposed to regeneration when we're infants. You can fall, you can break bones and stuff like that, and you heal right up. Anybody in their 80s and 90s, if they fall or break anything, they're in a lot of trouble for a while. It takes such a long time for the healing process to really heal stuff like that. And then at some point, we end up not having enough stem cells to even live, because we need these stem cells basically just to maintain our lives. As you probably saw, there was a slide in there before that says we're exposed to 82,000 different chemicals on a weekly basis. We need these stem cells to help our bodies, get rid of the toxins and help, if you get a bump or a bruise or a surgery or anything like that, we need these stem cells to really help us heal. So at some point, we go into what's called stem cell exhaustion, where we just don't have enough stem cells to even maintain our lives, never mind go and try to heal stuff. So when we start being prescribed drugs or take over-the-counter drugs, those drugs don't stop the degeneration. When you're given painkillers and cortisone shots and stuff, you become unaware of the injury or the degeneration that's going on. You tend to grind down the joints even more and make things worse. So some of these non-steroidal anti-inflammatory drugs like Advil, Aleve, you may feel less pain, but over time it does. It destroys the cartilage because you don't feel what's going on. Not to mention that, Advil, Tylenol, they have like a black box label. You take too much of that medicine, it will toxify your liver. It will, if you drink alcohol within 24 hours of taking it, it can really start to destroy your liver. So there are black box warnings on these over-the-counter drugs that people consume all the time. So, and this is what gets me. I see people coming into my office all the time where they've had, 3 or 4 cortisone shots done in a year, over several years. Now, according to the Mayo Clinic, you're only supposed to have 3 in your lifetime, not 3 or 4 every year. But the injections, these are the following risks: joint infection, nerve damage, thinning of the skin around the injection site, temporary flare of pain in the joint, tendon weakening or rupture, thinning of nearby bone, you've got osteoporosis, and then of course death of nearby bone, which is even worse, it's osteonecrosis. So in fact, authorities only recommend 3 cortisone shots in any joint in your lifetime because it'll really start to break it down. There's a lot of other things that happen besides just getting rid of the inflammation. So then we have opioid drugs like oxycodone and fentanyl. They may reduce the pain, they're very addictive. Opioid drugs now kill nearly 1,000 people each week, more than those that get killed in auto accidents. And when drugs fail, the only alternative up to now has been surgery, and all surgeries have complications. So, and here you go, a knee replacement surgery can cost an average $57,000 and followed up by 3 to 6 months worth of rehabilitation and healing. According to the National Inpatient Medicare Database, almost 5,000 deaths due to knee replacements were reported in 1 year. If you add in the blood clots and, to the lungs and heart attacks, pneumonia related to the surgery, another 10,000 people. That's 15,000 people. And this doesn't include the 17,500 people who reportedly get infections. So you have a pretty high probability of getting an infection from these types of surgeries. So these are the 2 types of regenerative medicine we offer right here in town. You don't have to go under the knife or anything like that. So let me start with the platelet-rich plasma. Platelet-rich plasma became a household name back in 2011 during the Super Bowl. It was the which one was it? It's the Pittsburgh Steelers. It was Hines Ward and Troy Polamalu. They're two main players. They both had pretty significant injuries, and they got benched before the Super Bowl. So they use platelet-rich plasma. They essentially draw the blood, and this is what we do in office. We draw the blood from the patient. It's centrifuged, and it concentrates all of the platelets and the growth factors that will help kind of accelerate the healing. So what we do, if it's a degenerated joint or if there's an injury, we even had a woman who had, pulmonary fibrosis. We did a protocol with her where she actually inhaled the platelet-rich plasma, and it helped repair her lungs. So it draws the immune system in. Platelets are famous for wherever they go, it brings the immune system in. So it just draws the immune system in, so it starts working in the area again. The cellular therapy, these are the stem cells. Now, there's no moral or ethical problems with these stem cells. They are harvested from a placenta from a very healthy mother who had a very healthy baby. It comes from the perivascular Wharton's jelly around the umbilical cord. And they're screened for every known virus and every type of bacteria to make sure that it's relatively sterile, that there's no infections or anything like that, or pathogens that can cause an infection inside there. So this is all done at New Life, where they have a chain of custody when they get a placenta that's donated, that they do this whole harvesting technique, and then the cells are frozen at the 0 Kelvin, where they stay indefinitely because there's no change in the DNA in the cells. So we buy these stem cells and the exosomes and other products from these people, and we use these as far as the injections with the platelet-rich plasma to draw this whole signaling effect where it starts to regrow a lot of tissue. It regrows cartilage, regrows tendons, bone, all the stuff that is needed when somebody has a badly degenerated joint or spine. It just kind of starts the whole repair process. It essentially causes, as we age, I talked about stem cell exhaustion. Our stem cells, they go into retirement. They essentially hang out in capillary networks everywhere. So when these stem cells are injected in there, the stem cells that we had when we were younger, when we were born, draws them out of retirement. So they start to divide and differentiate into the cells that need to be replaced. How we use it in the office, we usually, In my office, we use it for orthopedics. We like to stick with orthopedics. We like to do knees, hips, shoulders, backs. You know, did a guy's toe yesterday. We do wrists. We do basically all, you know, small joints and large joints in the body. It can be used for cosmetics. We haven't done anything with that. We did one hair restoration, and then everything else in between, you know, that's what they do at, you know, other places, sexual health, incontinence and stuff like that. You'd have to see Dr. Mike for that when he gets his license to be a urologist again. So what is regenerative medicine? It's a branch of healthcare research in tissue engineering and molecular biology which deals with the process of replacing, engineering, or regenerating human cells, tissues, or organs to restore or establish normal function. So it's restoring the function. You know, when organs work, it's all about the structure and the function. That's what these cells do, is they restore the function. Like, you know, I'm affiliated with a place down in Costa Rica, and T.R. McMahon is the guy who owns it. It's Infinity Medical. And he says to me, which we can't do in the United States, I want your patients, I want their heart valves replaced, their kidneys replaced, their livers replaced, you know, people who have MS or type 1 diabetes, rheumatoid arthritis, the autoimmune diseases. These stem cells can reverse all of those diseases, essentially, if we catch them in time before they don't get too advanced. So what are stem cells? They're undifferentiated cells. They're neutral cells. They're still neutral. They haven't changed into anything. The type of cell that they can or will become, and doctors can use stem cells to help repair any damage or diseased tissue that a patient might have. And some places around that do regenerative medicine, they will sometimes take the stem cells from the patient. They'll take it from the patient's adipose tissue, the fat, or they'll take a plug from the bone marrow. Very invasive procedures. And if your cells are 50, 60, 70, 80 years old, you're not going to have the desired effect. The cells that we use are 1-day-old adult mesenchymal stem cells. They have a doubling effect of every 20 to 24 hours. You take someone who's in their 60s or 70s, the doubling effect is every 60 to 64 hours. Plus, you know, if you're on, you know, all kinds of medications for stuff, so are those cells. They just don't work as robust as the brand new cells. So the doubling effect of every 20 to 24 hours, it's like that compound interest equation. So by the end of the month, you're going from 1 cell to 2 cell to 4 cell to 6 cell. It starts off slow in the beginning. By the end of the month, you're dealing with 1 billion cells. If you're doing it every 60 to 68 hours, by the end of the month, you're dealing with 400 cells. So we like to use the brand new cells. So these are the types of cells we use. This is where regenerative medicine, when in the early years, you know, got kind of a bad rap. They were using the cells taken from embryos and fetuses. They were pluripotent cells, so they would turn into anything and everything. And patients who went on this particular type of cellular therapy, they needed to be on immunosuppressive drugs. These cells, they're perfect. They're multipotent mesenchymal stem cells. They're immune system privileged. Your immune system leaves them alone. They're anti-tumorigenic. They do not turn into any tumors. They've never been known to enhance a tumor or turn into a tumor. And they take on the characteristics of the cells that we want to replace, like the cartilage cells, the bone cells, the tendon cells, so on and so forth. There's the 4 main things that these cells do. Number 1, they get rid of inflammation. You have an inflamed joint or inflammation in a joint that's degenerated, it quenches that, you know, that inflammation that's in there. Modulates the immune system. It will, like if the immune system stopped working in the area, brings it back in, so it says finish the job. If it's overreacting in the area, it disperses it out so it stops it from overreacting. These cells have an enzyme that gets rid of scar tissue. It eats up scar tissue. It radically reduces scar tissue. If you have a bunch of scar tissue from a surgery or an injury or whatever, gets rid of it. Last but not least, it helps your body regenerate. As I was saying before, brings your dormant or retired stem cells out of retirement, so the cells will start to divide and differentiate into the cells that need to be replaced. And we use them and we lose them. So we use them up when we have accidents, injuries, slips, falls. We can use up our supply of stem cells. As we age, the number of cells we have decrease and slow down. We also use them just to grow our bodies and maintain them. You know, we use up 90% in the first 20 years. They also produce less growth properties with age. So when we're born, we have the highest concentration of these stem cells that we'll ever have in our life. The ratio is 1 to 10,000. So that's why babies, when you see them, they're kind of chubby. Those are all stem cells. It's not so much fat. They're just stem cells. So, and they're also at their fastest when they're born, meaning that they double every 20 to 24 hours. So when you double every 20 to 24 hours, it starts off slow, and then you have 1 billion cells by the end of the month after 31 days. And when we're born, these cells also produce the highest potential and can make around 300 different types of proteins and other useful growth and healing factors that help us build our bodies. And we use up a lot of these, so we need, as you're young, you have a lot of falls and learning to walk and, bicycle accidents and so on and so forth. So we use up a lot of these resources, just getting us up to the first 20 years of life. So by the time we reach our skeletal maturity, we've used up 90%. So the ratio is 1 to 100,000 for other cells in the body. So we have to live the rest of our lives off of the 10% that's rest. And remember, we need these cells to help maintain our lives and fix anything if we have an injury or, anything like that, or, just to maintain our lives, get rid of the, toxins and all the other stuff that build up. So by the time we reach the age of 50, we have one of these mesenchymal stem cells for every 400,000 other cells in our body, and these cells now produce only 100 different types of the proteins. This means we have 40 times less the ability to heal ourselves when we're sick or injured, and 40 times less the ability to maintain our lives. So we're going to take a peek at someone's life over a 90-year lifespan. First 30 years, not much aging. The body is focused on growing to its highest potential during this phase. Ages 31 to 60, we start to see and feel the effects of aging, start to get gray hair, start to lose our hair, form wrinkles, just start to slow down. Don't recover as fast from an illness or an injury. We also start to get aches and pains that last longer and become our new normal. Then from ages 61 to 90, we really start to see the aging process accelerate and start to have more and more degeneration as opposed to regeneration when we were younger. Now, we're going to answer a few questions that people normally have at our talks. So, what does it cost, and does insurance cover it? This is something relatively new. Insurance doesn't cover it. What we do is, we give people a big discount if they're able to pay for it all at once, and if they can't, then we finance it in-house. Typical cost, depending on what you have. If it's a moderately degenerated joint, in a large joint, a shoulder, a knee, a hip, runs around $4,200. If it's badly degenerated, it runs up into around $6,200. However, a lot of people, when they come in, they want both their knees. We just had a guy sign up the other day, he wanted both his knees done. We have other people that come in, I want my shoulders done and back, and so what we do is we customize everything, to try to make it as cost effective as possible.
Question, does it matter what insurance you have?
It doesn't matter what insurance you have. The only thing that insurance covers once in a while is we do bracing. Like if it's just a knee, the insurances usually cover the cost of the bracing. Other than that, they don't cover anything. What's the next one, Mike? So this is the future of healthcare, because we're essentially able to give people in advanced age a donation of stem cells again. You know, where we can actually stop the degeneration and start the regeneration. And it's very exciting. I've been thrilled to see the results that we've been able to get at the office. It's a very solid success rate. We're talking a solid 80 to 85% success rate, which is better than most surgeries out there. When people get this stuff done, they're very happy with, the results. We're getting people to, we had a guy in the other day, we did his hips a few months ago, and he wasn't able to walk 200 yards without going into, severe pain and having to sit down. Now he can walk over a mile and still do pretty good. We've had some very, very good results. In fact, we're going to show you a couple of testimonials from people who've had the procedures done.
This is Pierre. He's one of our regenerative medicine patients. He had some problems with his back. He had a couple of spine surgeries over the past 20 years, and the surgeries were a success. However, he developed a lot of scar tissue. So, just elaborate a little bit on how the scar tissue affected you and the pain levels and everything else.
Two lower back surgeries, and still had lingering pain from the scar tissue. And as far as opting for another surgery, that was out of the question. Didn't want to put myself through that, and I opted for this treatment, which I was a little skeptical at first, and ended up being the best thing I ever did. It reduced the amount of pain, it reduced the scar tissue itself, and I feel better than ever. I would recommend this to anyone.
Yeah, that's one of the four main things that these cells do. Is they have an enzyme that gets rid of scar tissue. It worked out very, very well for Pierre. So, considering doing this, this is a very, very good choice to make if you have any post-surgical problems from spine surgery or anything like that. So, as you can see, it's proof.
Absolutely.
So here I'd like to introduce Yolanda. She's been a patient here, a regenerative medicine patient. And Yolanda, I wanted to tell folks here what your problem was and how it was affecting your life before you came in here for this procedure.
I had osteoarthritis for as long like 10 or 15 years. And like 2 years ago, I can walk almost. Going back for walking, cleaning the stairs, getting more things out my home. But now I feel very, very better.
So it was really affecting your life. And when you first came here, you came through a seminar that was posted on Facebook, and you came to one of my talks, and we got you in here, and you saw a nurse practitioner, and we did the cells, we did the injections with platelet-rich plasma. And how do you feel now?
Very, very bad. From like, sometimes my primary care doctor said, how is your pain today? I said, between 0 or 10, I said 20. Now he asked me, Johanna, how is your pain? I said, 0 or 2. I said, no, that's improved.
That's significant.
Yeah.
That's significant. Thank you, Yolanda.
And we have someone who's going to do a live testimonial. Diane, she had her knee done.
Yeah.
Of course, she's wearing one of our shirts too. So thank you.
Oh, yeah. Yes, I started was it February, I think?
Yeah.
February, to have my right knee done. And, I recommend it 100%. There's no pain to it, there's no downtime. You go in there, they're very professional with you, and, I haven't had any problem. And Pete says it's gonna last my lifetime, however long I live. So, yeah.
A lot of people, Diane takes good care of herself. A lot of people, it's one and done. Some people need to do boosters here and there.
Tell me also the other side of the story when you have knee replacement, how long it is and what you go through.
Yeah, if you want.
Yeah. I can give you the other side of the story. I've had 2 knees done before this was available, because I would've had this if it was available, but this was done quite a while ago. And, of course, they go in to make a 13-inch cut in your knee, and they go in there and they grind away. If you ever go online, all you gotta do is go on YouTube and see a YouTube picture of a knee replacement. And when you do, some people, it scares them away because it's pretty gruesome. They go in there with a saw and they're cutting, they're shaping your top bone, they're shaping the lower bone, because they have to screw in a plastic piece and metal pieces that are gonna rubber against each other to give you the new knee, which are metal and plastic. Okay, they do wear out with time, you know. That's why they don't like to replace knees when you're like in your 60 years old period. They want you to wait because they can wear out, especially if you're very active, sports or anything else. I waited till I was about, I think I had mine done when I was about 72, I believe. And I've been rough on them, but so far so good, but they're metal. They're a little late for regenerative.
Yep.
But I have other problems that I'm I'll be getting a consultation and see what can be done, because I wound up having spinal stenosis. All of a sudden, one day last June, like a light switch was thrown on. I was healthy, I could do anything. I could walk, I could run a marathon, no problems. I could climb ladders, no problems. I could open up milk bottles without having a problem like I have now. And all of a sudden, one day I got up and my fingertips were numb, and my toe tips were numb, and I was starting to lose muscle strength. And I said, what the hell is going on? So I finally got an appointment to go see an orthopedic surgeon, and they said, you gotta have an MRI right away. This sounds a lot more serious than rehab. So I had the MRI. When I got the MRI, I saw the picture before the doctor did, because it was done on the weekend. And I'm not a doctor, but I could tell there was a problem, because up here behind my cervical C2, I believe it is, you could plainly see arthritis was pushing in on my spinal cord. You could see the little indentation in the spinal cord. Now, spinal cords, which I found out, I'm not a doctor, but I found this out talking to people and looking online. Spinal cords do not regenerate on their own. That's one cell in your body, other than a process like this, do not regenerate on their own. So I was told, whatever I got, I'm gonna be living with it. Yeah. And the numbness may go away, it may not. They said it would take about 2 years to find out if there was damage done severe enough that I can't use my fingers anymore, my fingertips. Oh, it's a lot of fun typing on a typewriter when I misspell every word and other things. I try to drop a nut on the ground. You gotta see me working on my tractor, try to pick up a nut on the ground when I can't get that feeling you need to have. I can't even open a bottle cap on Cooper's Farm milk bottles without fear of dropping the glass bottle on the floor. My wife has to open it for me, because I can't even pull the rip strip off of it. I don't have that ability.
Well, can I just say too, when you have this regenerative medicine, there's no pain. You go in, they give you an IV for a series of, 4 or 5 weeks? 4 weeks?
Yeah, 4 weeks, and then we do another 2 between the platelet-rich plasma
and
injections.
then when they take your blood out and they put it in your knee, they freeze the knee, totally painless. There's no downtime at all.
There's plenty of downtime when you have your knee replacement the old way.
Absolutely, when you have surgery.
I went, I had to go through rehab,
There's
and,
absolutely
you know,
no
go through,
downtime at all.
and that was 7 weeks of $45 a week to go there to have rehab done.
Yeah.
And, you know, going through all the stuff you go through, just re-strengthen your muscles in your leg.
Yeah.
Then I had to do it all again 2 years later to get the next knee done. A lot of fun.
And if I need
So,
my
I
other
mean,
knee
you
done,
know,
I
the
will
old
absolutely-
ways of doing things were necessary then, because we did not have this.
Yeah.
Is there any therapy involved in this?
No,
None
no,
whatsoever?
no.
Sometimes,
My knee is good.
what Eric will do, he's the nurse practitioner, he's my partner in this business. He'll give people a prescription for physical therapy once in a while, whether they take it and go with it or not. But generally the people who do, will get better results. It's just simple physical therapy. It's it's not extensive.
Now, is there any restrictions while you're going through this?
The only restrictions,
Yeah,
it's minimal. After we do the injections,
yeah,
we want you to try to stay off the knee or joint or whatever, hips for 3 days. We want you to just kind of kick back for 3 days and take it easy. And then after that, you can go about your normal life. If it's a knee, we have a knee brace, that we get you. We want you to wear it like 80-90% of the time for a month. And then after that, you can, put it aside and not use it.
now how would this work if you already have a knee replacement?
It doesn't.
It doesn't?
Yeah,
Okay.
no, because
You got metal plates in here, you're not gonna regenerate anything, it's metal.
No, but how long is a knee good for?
Oh, that varies, Most of the time, a lot of people, it's one and done. If, for whatever reason, we had this one patient who's had just about everything done in his body. And the nurse practitioner that I had before, she was nowhere near as good as Eric, but, she did the guy's hips, and I don't know if she was able to get the full product into the joint capsule or not, but, he's like, yeah, my left hip is bothering me again. Can we do another shot? So all we did was straight product, no platelet-rich plasma. It was all cells and exosomes, and we shot it in there. And within a week, he's like, it's fine, wonderful again. But it's far and few between. Some people do come in for booster shots. We do have a product that is a diluted form of the stem cells that we use for people who want to do that. Or if somebody's on a lot of blood thinners, we have this one guy, he came in, he's on Xarelto, and so, it says right in, our informed consent that if you're on these things, we don't use the platelet-rich plasma because, your platelets and everything are too diluted from the medicine, so we just use straight product. We follow up with some of the diluted product, cells and exosomes. The exosomes that we use help, as far as building a scaffolding network around the area, kind of keeps the immune system at bay, and plus they're highly anti-inflammatory, so it all works very well together.
It wouldn't matter what type blood you got.
It doesn't matter. It's just not like, it's a transplant, but the cells that go in there, they have no external molecules on them, so your immune system leaves them alone. In the cells in your body, they're called major histocompatibility molecules, and your T cells go around and look, and if anything is off, your T cells go after them. These cells don't have that external membrane, so they're left alone. Their immune system privileged. So there's no tissue matching that needs to be done, like if you're going to get a kidney transplant or something like that.
How long does it take you to know if it's working?
We usually know within, a couple weeks. Sometimes we know within a couple days. Some people, they get the injections, it's like better than a cortisone shot.
How many series of injections do you need?
We usually do one round of straight product, with the cells and exosomes, and then we follow up with either 2 or 3 platelet-rich plasma injections.
And those are all done in your office?
All done in office.
Wow.
Yep. Yes.
A couple questions. So this could work for somebody who's on warfarin?
Yeah,
Okay.
absolutely.
And second, I hate to assume, but I'm assuming you would do x-rays before you do anything.
With everybody, yeah.
Right in your office?
I don't do I give you an x-ray order, you go over to the Auburn
Okay.
Wall.
That's what I was wondering.
Yeah.
And then when you look at those x-rays, doctor, are you then able to guesstimate more closely the cost?
100%.
Okay.
100%.
Then you'll know if it
Because
needs more than.
we're going it's called the Calgren-Lawrence scale.
Mm-hmm.
So if somebody has that much cartilage in their joint, or that much cartilage, or that much, or if they're almost bone on bone, we see a lot of people who are almost bone on bone. And if they're able to bend their joint and move it pretty good, there's a high success rate. So unless the joint is completely fused, chances are it's going to work.
Now, warfarin is huge. I mean, I know someone who's in
Yeah.
gripping pain on warfarin. And to have any surgery, of course, that complicates that.
Yeah,
But this could be an answer.
yeah, absolutely.
Yeah, can I take the x-rays that are already done, like from my MRI, they can ship it
Absolutely.
to your office so
Yep.
you can see it?
Yep.
Yeah, cause I got spinal stenosis.
So we are offering a free consultation to anyone who is interested. We usually charge money for it, but, you know, this time around, we're just doing a freebie for anyone who's interested, and, you know, you can talk to Dr. Mike about that. We could schedule you something, and, you know, we'll sit down with you, we'll figure out if you're a good candidate or not, you know. Want to make sure that you do have a little bit of cartilage in the, you know, in the joint, or, you know, when you're dealing with spinal stenosis and stuff like that, that's really, really tough, because we don't do intraspinal injections, we do perispinal injections, but, you know, the material extravagantes its way to where the degeneration is. In fact, I like telling this story. Lance Liberty, who owns a couple of regenerative medicine practices down in Florida, he was talking about how he had these two different women. They were both in their 80s. They wanted their knees done. They injected the cells into the knees, and it wasn't taken, so they were wondering what was going on. So they did this radioactive tag to the cells, and then they x-rayed, and they found that the knees actually went up to their brain stems because they both had Parkinson's disease. So the cells are drawn to where the most cellular destruction is happening. Yeah. I think, you know, if you have Parkinson's, this is the problem with the United States. If you have stuff like that, Parkinson's or any neurodegenerative diseases, the best results is go to Infinity Medical down in, you know, Costa Rica or Colombia, and they go by your body weight. Now, when somebody comes in, you know, for a large joint, we use 5 million cells in the joint. If you go down there, they use fresh cells. You know, they have their chain of custody with the placenta, and they go by your body weight. So they'll go and use anywhere between 150 million to 300 million cells, and it's just an IV push, and the cells will get right in there. And if somebody has some bad, you know, degeneration, stenosis, or any kind of spinal issues, they can do a intrathecal injection where it goes right into the spine.
MS was mentioned in your
Yep.
talk.
Yep.
Do you guys do anything with MS?
That's something that we have to send out to Costa Rica for, but that can be completely reversed. You know, it stops multiple sclerosis, type 1 diabetes, and rheumatoid arthritis. They're the same diseases. They all come from the same monoclonal cluster of T cells. These stem cells, they modulate the immune system, so it stops that whole, you know, aberrant attack. It stops those cells from forming, so they stop the whole autoimmune attack. And then over time, it starts to stimulate Schwann cells to, you know, remyelinate the, you know, the axon sheaths and stuff like that. So it takes about 4 or 5 months. It starts to regenerate all the nerves and everything for multiple sclerosis. Same thing.
How would they do that? They always said there's never a cure for diabetes.
Well, the stem cells will get in there. They stop the monoclonal T cell from, you know, its attack.
Mm-hmm.
They basically break up that bad formation of cells, so it stops acting aberrantly. So, and then after that, the cells will get into the islets of Langerhans, the beta cells in the pancreas, and start to repair, you know, those cells.
Would that even be like a juvenile diabetes?
Yes, that's what it is, type 1 diabetes.
Just for the juvenile?
No, it can have all the different,
If I
diet.
came down with it now, I
Yep.
could have that?
Yes. Yep. Yep.
Sounds miraculous, actually.
Yeah.
It is.
You
It
don't
is.
hear much about
Other cells, you know, you gotta take into consideration, you have labile cells, stabile cells, and permanent cells. I don't wanna get into a histology class, but, you know, you know, some cells only last 2 or 3 days, like the lining of your stomach. Some cells will, you know, if you need to, like fat cells or whatever, you know, those are stabile cells. You know, if you need to produce more of them for some reason, they produce. And then you have the permanent cells, like the, you know, your nerve cells. They're not, you know, reproducing anymore. they can grow, you know, if you have a nerve that gets cut, and that's a long time.
Very enlightening, very enlightening. Sorry, this is so hidden.
Well, you know what?
Sign me up.
You think, this is the reason why you don't hear
You have
about
to
it,
be able
you
to
know?
get up on the roof and do a roofing.
We have
job.
an FDA, and we have this huge pharmaceutical lobby that has, basically, if you have a medical practice where there's 5 providers, where you have a doctor and then, you know, 4 mid-levels, their budget for, you know, selling pharmaceuticals is $10,000 per provider per month. That's 50 grand a month that they're pushing in your face on TV with all these, you know, pharmaceuticals and drugs and everything else. They don't want this. In fact, I'm gonna have Google Ads. I'm, you know, working with this company, and I talked to a different guy who is gonna be working on my website, and he said, and I've heard this before, you gotta be careful with Google Ads. They'll shut you right down.
Mhm.
Because they have a vested interest in a huge pharmaceutical company, you know? So,
Multi-billion-dollar corporations, they stand to lose a lot.
yeah, oh yeah.
That's like a thing.
So when money talks, there's problems.
So, Doctor,
Yes.
this is my first time listening to you, but
Yeah.
who is your partner here?
Oh, this is Dr. Mike Adib. He runs the office. He was a urologist in Egypt, so he's working on, you know, getting his
And I
credentials.
noticed you said
Yeah,
another part of it.
yeah.
Oh, his name is Eric. He's not here.
Eric Wisniewski. He's soon to be Dr. Eric Wisniewski. He's a doctorate level nurse practitioner.
Good, no,
And-
it's just good to know, yeah.
Yeah.
Okay. This is very enlightening for me.
If one of these people with MS
Yeah,
wants to talk to you, should I pass your name on?
absolutely.
Okay.
Pass my name on to anybody. I'm here, you know, if you know of anybody who has any of these problems, just have them give me a call. We can certainly, more than happy to talk to anyone who has any issues and get them the help that they need.
Doctor, like with anything else,
Yeah.
you do something like this, but the nutrition and the exercise, you still have to.
This
that's
is
gonna
what
be
we
part of
do.
your
This is
body.
what we
It's gonna
do.
be part of
We
your body.
we get you in the highest level of, you know, prognosis before we do anything. We give you an anti-inflammatory diet with a bunch of supplements, you know, a cookbook with 200 different recipes, all these supplements. Then you're in every week getting an intravenous nutrition Myers cocktail to knock down inflammation in your body before we do anything like that.
So how long do you have to prepare us before we can have the procedure?
1 month.
A month?
1 month, and then there's 2 to 3 other procedures after that with the platelet-rich plasma or the diluted stem cells. You know, the whole procedure takes anywhere from 4 to 6 months. The stem cells will stay in the joint. They stay in the body for 4 to 8 months. You know, they don't stick around forever. After a while, they start to develop those molecules on the surface, and the immune system takes them out.
And once I have the procedure and it's done, I stay off this, I do my own diet, or?
You know, you're better off sticking with the diet if you get, especially if you get used to it, because it's better. It's better. But it's basically an elimination. You know, doing your own cooking, getting rid of seed oils out of your diet, and replace it with olive oil. You know, good butter, coconut oil or avocado oil, stuff like that. You know, when you're cooking stuff, as opposed to, you know, soybean oil and canola oil and, you know, all the different types of seed oils out there, you know, sunflower seed oil and all this other
So
garbage
bad
that's no
they
good for you.
couldn't implement the diet in the school system for the kids, instead of giving them all this junk.
They really should.
Exactly.
Yeah.
Well,
You're
I'm
working
thinking,
on it.
hopefully RFK's, you know, that's kind of his approach, so just
I
doesn't,
know.
can't be done so fast.
Right.
You can't eat cheap either.